not. And so there was this development through the 90s, beginning in the early 90s, throughout the 90s, with this new term that was decided to be global health. And the definition that I'll share with you for this is the collaborative, so keyword collaboration, actions taken to identify and address, in this word, transnational. So you have international health, but that's really clinical based, working bilaterally, so what we call country to country, right? So it's not really this idea of transnational, which is incorporating many, many different partners, many different countries, okay? Whereas public health, in kind of the historical sense, has really been viewed as kind of a domestic, a national effort within a country in order to improve the health of that country, and not necessarily an international focus. So what global health, the word global health, what the definition tries to do, is it tries to bring international health and public health together under kind of one umbrella to say, hey, we're going to do public health activities, but we're going to do this in a transnational way. So you don't need to worry too much about the details of this, but I just want to share that there's a lot of people who are still discussing this, and there's a lot of resources that you can look up very easily. Is Google the most popular search feature here? Google, so if I say you Google it, and you'll find a lot of comparisons. So if you just say, what is the difference between international health, public health, and global health? So go on there and look at this stuff and say, is Professor Anderson telling you the truth, okay? I think I am. But you can check me, all right? So check me. But there's a lot of really interesting charts that are put together that kind of wrap your head around this. And sometimes if you're like me, one lecture is not going to do it for me, okay? I need to sit with the information, I need to look at some other sources, so I encourage you to do that, to try to wrap your head around this. But again, bad PowerPoint skill. International health, public health. Some people more simply, this is about as simple of a conceptual view you could look at this connection, is that global health is kind of this intersection with international health and public health. Okay? Okay, but hold on, wait a second. There's something called politics. Does anyone know about politics? Yes? I think it's a political campaign season right now. Okay. So lots of talking, lots of rhetoric, political maneuvering. So I do want to share this because it's really interesting as you move into your future classes and you start moving into the field. Everything has a politic to it, right? There's politics to most things. Well, there's a politics to this, and the politics that public health, the field and the discipline of public health has been around formally for a pretty good amount of time, okay? And people have been doing public health activities for a while. And so, this is a paper, very well-cited paper, that argued that we needed this clear definition of global health. And so global health, in this paper, which was in 2009, all these people came together and were part of the consortium. Hello? They were part of this consortium called Consortium of Universities Global Health Executive Board. So Mike Merson was on this. He was actually my former boss at Duke University. So he's one of the people in the world leading the effort of developing global health as an idea. They published this paper and they said, hey, global health is not public health, global health is not international health. Global health is its own thing. It's its own definition. It's its own idea, right? And they lay out in this paper, and I encourage you to look up this paper and to read it. They lay out their arguments for global health needs to have its own definition. It needs to be its own thing. Okay? Were people happy with that? No, politics. 1 year later, this rebuttal paper was published in the same journal by, guess what school? The School of Public Health at Harvard University. And the dean of that school, Harvard University of Public Health, put together this paper, this rebuttal, and they said, no, 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 global health is not its own thing. global health is public health. And the argument was, we don't want you guys, you medical clinical people, creating something that you will be able to access public health resources, because then you will take resources away from the public health work that we're doing. Okay? So a competition of resources. Now, I'm happy to say that since these papers were published, there's a pretty clear understanding now and a consensus that global health is its own thing. And there's very clear distinctions of what global health does, and thankfully there's nobody on a major way fighting each other about, hey, you're going to take resources away from me, because thankfully there's been a lot of prioritization of new resources for both public health and global health, and there's been a lot of close connections and collaborations with these different entities. But I only share this with you because there's a reality. If you want to go do something new, you will have to face sometimes some politics, okay? And don't be discouraged if someone comes back and says, no, your idea is wrong. Because maybe that's not right. Maybe you just have to persevere and keep working hard and keep convincing people that, hey, I think I'm right, okay? And that's what we're seeing, is global health is now emerging and is emerged as its own entity, its own idea. Okay, so that leads me to now the last part of the lecture, which is what the title of the talk is, Priorities of Global Health. So you say, okay, Professor Anderson, you've told us what global health is in theory, the history of it, where we're at today, but what do we actually do in global health? What's the purpose of global health? Why do we even need to have global health? And I'm going to frame that for you in the talk about priorities. But before I do that, I want to mention real quick, what does it mean to live in a 4.0 era? Is that just a fancy talk title to get students interested in coming to see this guy talk? Okay. Well, I'll tell you that arguably 4.0 era is a real thing. If you can look at the technological revolutions, the industrial revolutions that we've experienced in history, we are in a new era of technological revolution. Okay? Raise your hand if you do not have a phone. Nobody, right? My great-grandmother has a cell phone. My great-grandmother has a Facebook account. Okay? And it's amazing. She'll message me sometimes on there and she'll send me funny pictures, you know? It's like my great-grandma, she's 98 years old. Right. So, we are in an age of new technology, new systems. It's just wild to think of all the capabilities that exist in the world. And so that's what it means to live in a 4.0 era. This idea that we are now in what we would call a smart society. Okay, but wait a second. Let's get back to that issue of ego, humility. If we're so smart, why do we still have disease? Why do we still have all these issues? Okay, well, let's talk about what we can do about those through the vehicle of global health. Because when we think about global health priorities, we have to think about where we came from, what have we accomplished in terms of public health on an international stage, international health in a global context. And I'll say, actually, in the last 20, 30 years, there has been a lot of successes, okay? There's been a lot of success in economic development. Many more countries now are now raising their economic profiles, their GDPs. Indonesia is one of those countries. We now have less people dying of specific infectious diseases. You now have more opportunities to access healthcare, to access education than any time in the history of the world. So there has been enormous amounts of success. But are we where we want to be? Are we at the ideal? Are we finished with our work? No. And you can tell by looking at this map. This is a global life expectancy map. And you can see here, yellow, orange, and red, you start to get into much lower life expectancies, indicating that there's health issues happening in these areas. So you can see all throughout the world, there are lots of places where there's a need to intervene on a health level. But even in countries like my country, the United States, okay? top GDP in the world, but the amount of disparities that exist in the United States is growing. And this is true in other developed countries as well. So it's not even just about addressing issues of health, it's also looking at issues of equity. Okay? So we have work to do. There's things that need to be done. What are those things we need to focus on? So this is the point of the whole presentation, I guess you could say. So we'll walk through some of these examples of what are the priorities. First of all, communicable diseases. I'm not presenting these in any order specifically, so it doesn't mean that I'm prioritizing anything. I'm just starting here because it's what we started talking about with the historical review. But as the WHO wrongly concluded, we can defeat all infectious diseases. That's not the case. We have a serious need to continue to address communicable diseases. So I showed this map. This was published in 2004. This map is a map that shows all of the emerging and re-emerging infectious diseases that were recognized in 2004. In 2017, a new map was put out. Okay, I'm going to show the new map to you. That's the new map. What can you tell? Is it getting better or worse? Well, it seems to be getting worse. Now, one thing to think about is one reason that you see a lot more on this map than on this map is because we now have technology capable of identifying diseases that we didn't have in 2004. But it's definitely not getting better. We're now recognizing there's a lot more infectious disease threats out there than we ever thought were possible or that we knew about before. And now we have a lot of tools that help us basically figure out there's a lot of things out there that can kill us, okay? So this is something that is a concern, emerging infectious diseases, new diseases. What are the factors influencing this, new diseases? Well, there's actually a lot. And these factors are not health factors. These are things like global travel. Raise your hand if you've flown outside of Indonesia. Okay, a couple people. You've been in an airplane, right? You ever been on an airplane and as soon as you sit down, you hear, are those people infected with something? Where are they taking that disease? Maybe they're taking it somewhere, okay? So we have globalization and movement of people, moving diseases around the world. Other things like poverty still affecting infectious diseases, adaptation and change. One area that I focus a lot on, but it is a very interesting area to think about, these are some examples of some emerging infectious diseases. Monkeypox, flu, SARS, MERS, Nipah, Ebola. Maybe you haven't heard of all of these, but these are all different emerging diseases that have happened in the last 20 years. What do they have in common? They have an animal component to them, okay? So it's called zoonotic diseases. Does anyone have a pet? Dog, or anyone interact with animals ever? Okay, so animals can be a risk factor for certain diseases. And many of you may know the history here in Indonesia, also throughout the world, of an outbreak of high-path avian influenza virus. So that was an example of a very serious zoonotic disease that occurred. But beyond just infectious diseases, things that are emerging, re-emerging, have you heard of antimicrobial resistance? Yes. I would argue that AMR, antimicrobial resistance, is probably going to be one of the biggest concerns from an infectious disease standpoint in our next 50 years. We are running out of antibiotics that work. We have things like MDR, XDR, ABC, TBC. I don't even know all the acronyms of TB, right? TB that's not able to be treated because we don't have effective drugs. This is true for other bacterial infections as well. One being that I deal with in China is E. coli, where in 1 year they recognized this resistance to one of the top antibiotics, okay? If you're going to have an antibiotic, this is the antibiotic that's going to kill anything that you want it to kill. It's the last line of defense. Well, it turns out that this form of E. coli is now resistant to that last line of defense antibiotic. Okay? We found this in China, and 1 year later, there were human cases occurring in the US, the UK, and other parts of the world. So does this E. coli circulate here in Indonesia? Do we know? I don't think so. All right, so antimicrobial resistance is a big concern. The next priority, which I would argue should probably take the largest amount of allocated resources to address, okay, is non-communicable diseases. Who in here has an interest in non-communicable diseases and studying them? Have you guys decided that yet? Okay, so here's a little bit of information about non-communicable diseases. Based off the latest global burden of disease statistics, you don't have to worry about the numbers, but what I want you to notice is the colors, okay? The red and the orange represent infectious diseases, so communicable diseases. The blue represent non-communicable diseases. Okay, which color is greater? Blue, right? So if you're the Secretary General of the WHO and you're allocating resources to prioritize certain health outcomes, are you going to prioritize more resources to communicable diseases or non-communicable diseases based off of this data? Okay, you guys are going to make great Secretary Generals. Yes, right, so it's clear there's a much greater burden in non-communicable diseases than communicable diseases, okay? But why do we see that now? You said, well, Professor Anderson, you spent like 30 minutes going on and on about infectious diseases. We talked about plague, we talked about flu, we talked about yellow fever. Is that just because you're an infectious disease epidemiologist and you're trying to persuade us to be interested in infectious diseases? Okay, not entirely, but mostly it's because that was the priority during that time, infectious diseases. But what happens is when you have development and you have conditions improving, like people have better access to clean water, they have better access to things like air conditioning, and you don't have as many mosquitoes running around, then you have what we call a transition, an epidemiologic transition. So infectious diseases will go down in incidence in a population, and non-communicable diseases will go up. So as we are correctly dealing with infectious diseases, people are having longer lives. But what happens when people live longer? They're at greater risk for non-communicable diseases like heart disease, cancer, even things now we're starting to see related to other areas in terms of nutrition, diabetes being one. So non-communicable diseases will be a major priority, a major area where we'll need people, we'll need resources that are going to be willing to figure out how do we address non-communicable diseases, how do we create interventions, how do we manage populations that have chronic conditions. Next, maternal and child health. There's been a lot of success in maternal and child health. We have an expert here who worked in this area and had great success in seeing reductions in child mortality, infant mortality, improvements of maternal health overall. However, when we look at the data, are we at 100% reduction? No. There's many regions that still have a high rate of child mortality, morbidity issues, infant mortality, childbirth issues, but it also expands a greater range of issues. Maternal health is not just about having access to midwifery or having access to childbirthing services. It's also about family planning. It's about empowerment and having the ability to access things before you have children. So this is an area that's going to continue to receive a lot of prioritization, and particularly in specific regions where we see a higher rate of incidence of issues. And the other thing I'll mention is that there's certain causes that are disproportionately influencing particularly child mortality. And so some of those causes are predominantly respiratory disease still is a large contributor to overall child death. Diarrheal disease is a big contributor. And then we have birthing complications that happen, so kids dying in childbirth. Global health priorities. Next one, healthcare access, but not just access, quality. I know this is a big conversation in Indonesia, right? So if I say universal health care coverage, you guys, that elicits a feeling in you probably. You have probably discussed this with lots of people, right? Well, what does that mean, universal health care coverage? Access to health care is a part of that, but access is not just going and seeing a doctor. There's many more components to what healthcare access entails. And I like this chart. This is from European Patients Forum. But you can talk about it in a little bit more detailed way. Number one, is healthcare available? So is there a doctor that exists? So is there a clinic here on the university campus? Yes. Okay. If that clinic wasn't here, would it be as easy to access a doctor if you were sick? Probably not. So availability, having available services. Affordability. When you go to the clinic on campus, do you pay for the service? No. If you had to go and you had to pay, I don't know, 5 million rupiah, would you be able to go see the doctor? No, right? So, affordability is a very key component. Pricing services correctly. Accessibility, these are things related to access other things. If you live far away from a clinic, do you have a car? Do you have transportation to get to that clinic? So accessibility. Adequacy, is the quality there? If you go to the clinic on campus and you see the doctor and they just say, oh, I see that you're coughing, go back and rest, I think you'll be okay. Is that adequate? I said, doctor, I've been coughing for 5 months, okay? No, not adequate. So quality is important. And then appropriateness. And this has to relate to, if you have a population and you have lots of people in a population that have cancer, okay? But you have no cancer specialties. That's not an appropriate healthcare system for the population burden. So healthcare access, when you think about that, incorporates many more things than just saying, oh, can I go see a doctor? And this is where we get into this part where we're going to see a lot more emphasis on healthcare strengthening. So creating robust healthcare systems, addressing these issues of accessibility, affordability, etc. And here's a great chart, and I hope you guys can look at this a little bit further. This came up actually in a meeting we were in, but this is very true. You guys have the National Health Insurance program, and this is a program that exists in other countries too. But having insurance coverage doesn't necessarily mean you have universal health care, because there are a lot of other components associated with what it means to actually have universal health care. So we need people trained in this area. We need people to work in this area in order to help us build resilient healthcare systems, to build processes that allow people to access good quality healthcare. And then lastly, of the priorities, we're almost done. You guys have been great. Environmental health, okay? So we think back to Hippocrates, and Hippocrates wrote that there was a link between health and environment. And that's still very true today. So climate change. Does anyone know about climate change? You see it in the news every day, probably. Major efforts happening here on studying and understanding climate change. And there's going to be a lot of work needed to understand climate change and health. An area that is also of concern is air quality. All right, I looked at the air quality index last night in Jakarta. AQI is a measure of the amount of certain particulates, so these small particles that exist in the air. That's an indicator for pollution and for health issues. In Jakarta's AQI last night was 154. Okay, so this is a measure. This is in my city, and one day we had a bad AQI day in China, and it was 152. Unhealthy is what it says. So can I go outside? Should I go outside and be in that air if the air is bad? It's not recommended, but many people don't have a choice, right? They have to go outside, they have to work, they have to go to work, they have to do things. So this is another issue. Air quality. What kind of air quality controls do we have on a population and a national level? We know that air quality influences health issues, right? Respiratory disease, it influences chronic conditions. It can cause greater issues down the line. And in one study that was released, it estimated that air pollution results in 5 to 7 million deaths per year. okay? So if you eliminate air pollution right now in the world, you're going to save the lives of 5 to 7 million people per year. So that's a significant number. Oh, sorry, and I added this. Last but not least, technology, a priority in technology. We live in a 4.0 era, global 4.0. Do these look familiar? Yeah. All right, tell me this, survey. Which one is more popular, Facebook or Instagram? Okay, that's what I was told. I was told that only old people have Facebook now. Is that true? All right, so I guess I need to go and get an Instagram account to be cool and hip. All right, but social media. Social media, do we really know the power of social media? Both the positive and the negative. You guys know that there's some negative things about social media, right? A person can ruin their whole life with one click of a button on social media, okay? So this connects to a very important topic of global mental health, right? Mental health is another area. Social media, but social media can also be a tool for good, right? It can be used in a powerful way. Health promotion activities, things that we were never able to do before, we can do now with social media. I can talk to my great-grandmother on Facebook, but none of you have Facebook, so, all right. Digital health is another area we're talking about. We have technology. Everyone has phones, right? Smartphones, we have apps. But this actually was argued that more recently, the digitalization of health is creating what we call fragmentation of healthcare services. So again, we need people, we need processes that will help coordinate this technology. It's powerful tools, but we need people to continue to develop it out so it has effect. And then lastly, new technologies for diagnosing and treating diseases, including chronic diseases. So we need people to work in these areas, or we need to have partnerships with people in these areas. So I talked about a lot of problems, right? The overarching problem is this. There's no discipline. There's no one discipline. No one person in here is able to manage or impact all of these issues that we talked about, right? No one discipline can do it. They're complicated, they're complex, they're integrated problems. In addition, no one agency, no one organization can do it on their own, okay? And lastly, we have limited resources. That's an important point. It's hard to do things if you don't have funding, if you don't have resources, if you don't have money, all right? So how do we stretch the limited resources that we have to have the greatest impact? Well, that's where we talk about this idea of global health, where global health comes into play. A Case for the Future of Global Health is a write-up on Harvard School of Public Health. And Public Health School at Harvard has embraced global health. So they have a global health center, or actually an institute there. But this person who wrote this, very prolific, he was the dean of the school, and the case is this. The world is changing rapidly. But we must prepare and embrace it, okay? And we must be prepared to face the challenges of the future, of our 4.0 era. So you guys, Professor Anderson, how do we do that? How do we address these very complicated issues? You know, you lay out these issues. What do we do as students? Well, you've taken the first step is that you're in college, right? You're in a training program. You're getting trained to learn a discipline, to be able to have impact, to do something positive. And we'll say, you know, I think one of the things when I did public health is, you know, you don't choose public health for the money, for the prestige, for the, you know, if you want to make a lot of money, you go down to the Faculty of Business, right? Or finance. No, you guys chose to be in public health. You're choosing to learn public health for a reason. Why are you choosing to do public health? Why do you care about other people? Do you care about other people? Is that what? Okay, why? Why do you care about other people? You have a motive to doing this, right? You want to help. You want to have an impact. You want to get the training to do that. And so, global health serves as a way, in my view, to coordinate efforts and to equip individuals like you, the students, in order to have the greatest impact on these complicated issues. All right? So what skills, what tools do you need? Well, this is actually something that is being heavily discussed and heavily championed here by your true champion, Professor Adik Wabowo. Okay, when I talk to Professor Adik and I say, hey, Professor Adik, what skills should the young people have to have the greatest impact on these complicated issues? And she'll tell me, you need to have hard skills, right? This is things that are pretty common sense. Management, managing complex systems, managing processes, communication. Does public speaking terrify anybody in here? Yeah, me too, okay? I was terrified before the moment I got up here to speak. It's hard. Public speaking's hard. Communicating can sometimes be hard, but it's a very significant, important skill. Writing, being able to communicate your ideas in writing. Okay, communication is very key. Organization, analytical. You guys learning analytical methods. Data analysis. How do you handle data? So analytical. Hard skills, right? But Professor Adik would then say, you know, Ben, the hard skills are not enough. Okay? You can learn all these and maybe, okay, you'll have a career. But if you really want to work, and this is what she'll tell me, she'll say, if you really want to work on these global health issues in the international context, from her experience doing this in the WHO and other places, she says, you need more than hard skills. You need these other things, soft skills, things like ethics. When you work in different places in the world, sometimes you're confronted with ethical issues. You need to know how to work in a team, interdisciplinary. Okay, you're working with many different disciplines. Interviewing. Has anyone ever done an interview? Is it hard to do an interview? I mean, do you go up and show up in an interview in your shorts and say, okay, I'm here? No, there's a process of presenting yourself so that you can have the most positive outcome for that interview. So soft skills. So thinking about a person who, what is it that I need to have as a student in order to be successful to work in international health context, what we're calling now global health. What is the global health person of the future going to be? They're going to be people that have these skills, right? So if you want to work in the WHO, you want to work in the UN, you want to work in an international agency, or you want to work on a national level, these are what they're looking for. So when you ask yourself, what am I doing here, or how am I getting this training at the University of Indonesia, you are getting it. And you can take advantage of every opportunity to try to develop these skills out so that you can have the most success in your future. Well, Professor Adik has thought so intentionally about this, and that's one of the things that they're doing here at the Global Health Initiative. With this emphasis of this idea, in my experience, is that no collaboration, no international activity begins without starting a relationship. So having relational skills, the ability to build relationship with people, sometimes in complicated organizational structures. So the Global Health Initiative, oh sorry, I didn't get to that point yet. What I wanted to say is basically, and I'm coming to the very end, so thank you for hanging in there with me. What I want to say is that this isn't easy. Interdisciplinary work is very challenging sometimes. You're working with different people who have sometimes different priorities, they have different interests, they may have different backgrounds. So how do you come together and how do you get everyone to come together to work for a common purpose? Okay, this is something that sometimes just comes with experience, but there's opportunities for you to get that kind of experience. So this is it. So if you didn't listen to anything else, it's okay. I want you to listen to this one point. This is the whole message of today's presentation. Sometimes, many times, I hear this phrase. It's often said that young people are the leaders of tomorrow. Do you believe that? You think you're the leader of tomorrow? Are you going to lead tomorrow? You're going to lead tomorrow? You're going to be leaders? Everyone's going to be a leader? Okay. I take an issue with this phrase. I believe that this phrase is true. I do believe that everyone in here is going to be a leader of tomorrow. But I disagree in that it should include one more thing. that you are already the leaders of today. You are the leaders of this university, you are the leaders of your family, you are the leaders of your friendship groups. You have the opportunity to be a leader right now. Okay, so don't forget that. You see, that was exciting. Good. I want you to be excited about leadership. So, my question to you then is, if you have the chance to be a leader today, right now, are you ready to lead? Are you ready? Okay. Global Health Initiative Indonesia is going to be an exciting opportunity for you to engage in global health activities. Okay, Professor D. Boboa, Dr. Februari are working very hard to develop this out into something that's going to be a very practical opportunity for students to connect to opportunities. All right, so I just want to mention that in the sense that I am so excited about this initiative for you guys. I'm excited about the idea of global health being here. I'm excited about you taking, even though I know that this lecture is compulsory, so that I appreciate you coming to listen to it. I'm excited about global health. And I'll lastly finish with just this. Duke Kunshan University does have a master's degree program in global health. This master's degree takes place with the partnership of Duke University, which is again a top 10 university in the United States. The students who matriculate or graduate from Duke Kunshan University, in addition to Duke University in the US, they get the same diploma, so you get a Duke degree. So you would graduate with a degree from a top 10 university in the US as well as in the world. And as Professor Boboa mentioned, the way that the degree is structured is that you have some on-campus activity that you do, but then you go, you do a summer field work that you have financial resources to do. So we give stipends to our students to go do a research project in another country, preferably a country you've never been to before. And then after that, you have the chance to go and study at the university, or Duke University in the United States. Okay, so you get to be a part of the Duke network. So if you have any, this is just some of the places our students have been, all 6 continents except Antarctica, and they do a wide range of different projects throughout those programs. But if you have any interest in that, you can come and ask me about it, or we can send you some information about how to access information. We take applications every year. We do give out scholarships to people. And I think the students who graduate from our program, they go on to do a lot of really great things, including working in international organizations. They go on to medical school, PhD programs, etc. Okay, with that, I know it was a long time, but I want to thank you. And thank you for the invitation for being here.
Thank you for listening, and thank you for being patient still in this room. Thank you so much. One more applause. Before I start with the discussion, we have also another distinguished professor here from Universitas Indonesia, Professor Ratna Juwita. So today is very much an epidemiology color in this room. I saw before Professor Penny from nutrition, but perhaps she was already out. So it's not a promotion of the Kunshan, but you can see the opportunity. If you go to China, you will actually reach 3 countries at the same time. They always start in the fall, but you are not eligible yet because you are still in FKMOP. So wait for another, I think, 1 more year, then you can start applying. So with this, I would like, we still have time because this is a 3 SKS, so we finish at 12:30. And I think what Professor Anderson mentioned is actually what we are discussing in the class, right, Professor Ratna? That is going to be your homework. Exactly the same references that we gave. And exactly the same questions that we gave for the students. So the chemistry is there between Ben and Adi, A and B. So, okay, start. Who will start the question? Let us make this class alive. Who will start asking questions? I have a question, actually, but okay, please come here, take the mic. Yes,
Thank you, Professor Adik, and also Professor Anderson. My name is Sultan. I came from the Department of Nutrition of Public Health, and I'm actually pretty interested in the global health issues because, but my question is, we're in Indonesia, we're studying about global health, while you define global health as a transnational issue. I'm actually, what do you call it? I'm interested to know about how do you study global health in a practical level on classes on Dukunshan. I mean, how do we learn to be a transnational population if we only study with Indonesian people in our class? Thank you.
Yeah, that's a great question. Yeah, so, you know, there's some different components to what it means to receive global health training. And I would even say the training is not even the formal education, it's not just formal education. Global health training also comes through experiential opportunities. And one of those experiential opportunities I think is very important is the opportunity to engage in a transnational way, right? So to go out beyond your community, to go out beyond even your country, to work with other people in the world. On that note, so the first part of that question was really about the practical components of global health training. So, is global health a discipline? That's a question I didn't include in this slide, but it's a question I can ask. Is global health a discipline? Well, arguably, it's not necessarily a discipline. So if you were to call your family back up and just like public health, you said, okay, what are you studying? I'm studying global health. Okay, what does that mean? What are you going to do? What are you specifically going to do, right? My mom would always ask me, what are you going to do, right? So, global health is more of, again, this idea of coordinating and organizing health issues around the ability for us to come together again in this transnational way. So the practical training modalities, the training that comes with kind of a global health program, are these. One is for you to be exposed to just the concept and idea of global health. Right? So that's what we did in this class. So that's just, you're introduced now, you guys will forever know what the idea and the history of global health is. But then we start to focus on specific categories. So in global health, we actually start to move into practical training, similar to public health, where you would start getting into maybe nutrition, you go into epidemiology, you go into other things. What global health does is it kind of organizes the training around what I just mentioned to you, or the issues, right? These categories. So a class that a student in our university would take, would be in a standard global health program would be maternal child health. We spend a lot of time on maternal child health. We want people to understand. We have a series of classes to people understand non-communicable diseases. Right? But we also want students to receive disciplinary training. So this is where I kind of like that the Global Health Masters is a master's program, right? So what typically happens is we have people coming to a training that are already disciplinary. So they are either already an epidemiologist, or they're already trained in nutrition, they're already trained as a laboratorian. But then the global health is a way for them to figure out how to connect their disciplinary training to the global health issues that are taking place. And that's the challenge, right? So you may be trained in a disciplinary way, but really the big question is, how do you work at an international level? That's really what global health is about. Global health is about these transnational interdisciplinary partnerships. So when you talk